Good afternoon. Today is World Pancreatic Cancer Day. Joining us to talk more about this disease is Dr. Rebecca Keim. She is a pancreatic surgeon at St. Peter's Hospital. Good afternoon, Dr. Keim.
Good afternoon.
So first, let's talk about the basics of the pancreas. What are its functions?
So the pancreas is an organ at the back of the abdomen. It has two major functions. One is what we call an endocrine function, where it makes hormones that help regulate someone's blood glucose levels. The other function is exocrine, and that means it makes various digestive enzymes that it secretes and helps patients digest their fats and proteins.
And as we talk about, pancreatic cancer, when these cancerous cells develop, how do they affect the pancreas, and what, signs and symptoms, if any, can that lead to?
So oftentimes when people develop a pancreatic cancer within the gland, there may be no signs or symptoms, so it's a fairly silent disease. Occasionally it can cause someone to develop diabetes somewhat suddenly later in life. If there's a tumor that's large enough to compress other structures, for example the bile duct, they may develop jaundice. Really the most kind of common symptoms of pancreatic cancer are unintentional weight loss, some epigastric pain that might radiate to the back, something called early satiety, where basically people eat and feel full early, or just some more subtle symptoms like a mild epigastric pain, again with weight loss.
And, that back pain that you mentioned, is that typically severe, or is it mild in nature, or can it vary?
It can vary, but I think what's unique about what we call pancreatic pain or pancreatic malignant pain is that it's upper back pain. It's not the typical lower back pain many of us have. It's an upper back pain that's pretty much usually constant. People may describe it as starting in the front of the abdomen, going to the back. It's also somewhat positional, whereby they feel better if they're leaning forward and feel worse when they're laying flat. Those would be concerning findings for potentially a pancreatic type pain.
And what are some of the risk factors for this disease?
Really the most modifiable risk factor is smoking. Smoking is very heavily associated with development of pancreatic cancer. There's also a certain percentage of pancreatic cancer that is familial, meaning it runs in families. We consider a patient to have familial pancreatic cancer if there's 2 first-degree relatives with pancreatic cancer.
And are there different types of pancreatic cancer?
There are two tumor types of primary pancreatic cancer. Rarely we'll see a metastatic tumor to the pancreas, but when people think of pancreatic cancer, what they're talking about is pancreatic adenocarcinoma. So it's a cancer that develops in the glands of the pancreas itself. And that's the one that has a fairly poor prognosis even when it's caught early and even when all treatments were able to be completed. A slightly rarer type of pancreatic cancer is called a pancreatic neuroendocrine tumor. It has a vastly different behavior and prognosis. And so when I see patients, I'm very clear with them on which tumor type they have and how they would offer their, alter their treatments.
And what types of treatments are available to treat pancreatic cancer?
So with typical pancreatic adenocarcinoma, we would recommend a multidisciplinary approach to the treatment, which usually involves chemotherapy. If it is something that is operable, surgery followed by further chemotherapy. Occasionally we also have the patient receive radiation prior to surgery. If patients are able to complete all their therapies, meaning chemo, surgery followed by further chemo, they have the best chance for long-term survival. Pretty much in this day and age, it's fairly rare for someone to see a surgeon and go immediately to surgery for pancreatic cancer. They really need to have the systemic therapy with chemotherapy prior to that.
And what about the use of robotic surgery? Is this something that you do a lot of in your practice?
So traditionally, pancreatic surgery has been done with traditional open approaches. Mainly that's because of its position in the abdomen and also the complex anatomy and reconstruction involved with these operations. Laparoscopic surgery has been applied to pancreatic surgery for at least 15 to almost 20 years now, particularly when we take out the tail of the pancreas, because that's a more straightforward operation. More recently, we've been applying robotics to these operations because it's basically taking our techniques and tools we use with open surgery and allowing us to use it through the smaller incisions. While most patients in America are operated on by an open technique for pancreatic cancer, more and more are able to have a robotic approach. And with us, we find that if it allows patients to have a lower complication rate and a shorter stay in the hospital and allows them to get back to getting their postoperative chemo, that our hope is that it's going to help their long-term survival.
And one of the benefits that we hear a lot about is recovery time.
Correct.
with robotic surgery.
Right. So in general, it appears that when people have robotic surgery, they leave the hospital 1 to 2 days sooner than someone with an open operation. And then their recovery at home is quite a bit quicker. We're within 2 to 3 weeks, they're back to all usual activities, while the normal recovery from an open pancreatic surgery would be 6 weeks or more.
And where are we right now, as far as the future of treatments? Are there any new treatments on the horizon?
Right. I mean, in my mind, I hope we could find methods to detect it at an earlier stage. I also would hope that we have further methods to identify high-risk individuals so that they can be screened. As we start profiling more and more tumors, we're also hoping to find more common mutations that can be targeted with certain chemotherapy agents. Pancreas cancer over the years has been found to be fairly resistant to most chemotherapies, and only the more recent combination of several drugs has shown some effectiveness. But obviously there's a lot of areas for research, and I welcome any and all out there because we need help with this disease for sure.
Well, thank you so much, Dr. Rebecca Keim, for taking the time to talk with us today.
Thank you.